Hello, today on the Leukopak Lady, I'm continuing to discuss cryopreservation, now focusing on the technical aspects of this practice. Today I will focus on some of the most prominent issues with cryopreservation. One of the top issues with cryo is the need for a slow and tightly controlled drop in temperature to minimize damage to cells by the formation of ice crystals. Ice crystal formation damages cell membranes from the inside out and will kill the cells. Controlling the drop in temperature is very important, but to prevent cell death during cryopreservation, a cryoprotectant like DMSO must be used. During the temperature drop, DMSO helps maintain osmotic balance, slows down the formation of ice crystals, and strengthens the cell membranes, all of which minimizes damage to cells. However, DMSO can also be very toxic to the cells as well as to the patients receiving a cryopreserved therapy dose, representing another significant problem with cryopreservation. So it's a very delicate balance between the use of a toxic cryoprotectant and the drop in temperature that makes this practice work. And as you can see, cryopreservation can be very technically challenging, especially when the cells are at high concentrations. There's a difference in this practice when the cells are at lower concentrations, like in vials, compared to higher concentrations, like in leukopaks. Also, cryopreservation is a potential entry point for bacterial and fungal contamination of leukopaks that does not exist with fresh material. So for these and other reasons, good cryopreservation requires well-trained and highly skilled professionals. The best way to know whether a collector is capable of performing this technique well is to examine their data from their stability study. If the post-thaw viability is high, then you know they have perfected this practice. Another technical problem with cryopreservation is the fact that the thawing of the cells requires a specific regimen and well-developed technical skills. Unlike the freezing process, which needs to proceed slowly to prevent the formation of damaging ice crystals, the thawing process needs to proceed rapidly to minimize the damage of those same ice crystals. Often scientists and developers assume that if the viability of the thawed cells is poor, it must be due to a problem with the freezing process, but it is actually often a problem with the thawing process. In addition, the timing of when cells are tested for viability following thaw is important. Cells need time to recover from freezing, but not so much time that they begin to experience the toxic effects of DMSO exposure. And employing a wash step before testing can help, but all of this still takes very good technique to work well. Finally, some cell types do not cryopreserve well compared to others. For example, CD3 positive T cells are very robust and cryopreserve very well and recover well from thaw. However, NK cells and rare T cell types like gamma delta T cells do not take well to cryopreservation. As well, CD34 positive stem cells do not cryopreserve well. This means that cryopreserved starting materials that are rich in hematopoietic stem cells, like mobilized leukopaks, bone marrow, and cord blood, take a major hit to the viability and function of the stem cells within. On the other hand, leukopaks cryopreserve very well, especially if they're low in contaminating red blood cells, granulocytes, and platelets, and if you're using traditional T cells in your therapy. If you're using a non-T cell type in your therapy, it would be a good idea to either use fresh starting material or optimize the cryopreservation process to suit your cell type specifically, rather than to suit the T cells in the bag. On the next episode, I'm going to bust the myths and talk about the benefits of cryopreservation. See you then.